So the ideal time to start breastfeeding is within the first few hours after delivery. Within the first few hours after delivery, the baby is very alert and is eager to feed. So within that space, you need to start breastfeeding so that it can also help boost your milk supply. 2, the first breast milk that is produced within the first few days after delivery is called colostrum. And this milk is high in antibiotics and also high in protein. But generally, every child feeds differently. Now, when you take a healthy baby can feed between 8 to 12 times within a 24-hour cycle, including the day and night. Some babies that like sleeping can breastfeed about 6 to 8 times within the day so that they can get enough energy to endure the longer sleep within the night. And also with the ages, when you look at ages, older babies tend to feed more than the younger ones. So what we say is that you need to encourage the younger ones, especially the ones between less than 3 months. You need to encourage them to feed. But as to the number of times or how often, there's no exact rule. You need to know your baby's feeding pattern. Yes, you need to breastfeed at night, but that will be for babies less than 6 months. And the reason is that babies less than 6 months have a smaller size of stomach. So the little milk they take, they begin to exhaust it within the day. So most babies get hungry late at night. And that is why you need to feed a baby throughout the 24-hour cycle, either 1 hour per feed or probably every 2 hours. And also one thing you need to note is that as a child grows above 1 year, the frequency at which you feed at night reduces. So there are many different breastfeeding positions that may be comfortable for cesarean mothers, mothers with twins, or mothers with preterm babies, or probably premature babies, or even babies that are very small. But for the purpose of demonstration, I'd like to recommend the Ghanaian Women's Guide to Feeding Babies and Toddlers. In this book, it includes practical demonstrations for feeding babies, whether you're a cesarean mother or you delivered probably by true vaginal delivery. And all these positions are in the book. So most mothers tend to pull their breast right from their baby's mouth if they want, or when they want to break suction. And that is an inappropriate breastfeeding practice. And this results in soreness around the nipple. But the right way to go about it, if you want to end suctions or you want to break feeding, you can take your little finger and set it at the corner of your baby's mouth whilst breastfeeding, just to open the mouth a little bit, probably just to separate the two gums, and gently slide your nipple out of the mouth so that you don't have the hard palate of your baby's mouth scratching your nipple. Another way you can also do it, you can just gently lift your baby's chin slightly away from your nipple. So knowing the readiness for your baby to feed or the hunger cues of your baby, it's very important because it helps you to respond to these cues very faster. And mothers that are able to identify these cues always have their babies latching properly to their breast or feeding better. But there are certain signs you need to watch out to be able to identify the readiness or the hunger cues of your baby. We have early signs, mid signs, and late signs. But for the early signs, sometimes you see your baby staring directly at you, probably moving their head, moving their arms at the same time. Sometimes you also see them trying to use their mouth to pick things around. These are common signs or the early signs that shows that your baby is quite hungry or is hungry. Now, some others look out for crying, the sign crying. Crying is the last sign. So if you see your baby crying, don't pick your baby and just put them right away to the breast. During the crying moment, they feel agitated. The right thing to do is that if you see your baby crying, which is you identify as a sign of being hungry, you need to first of all calm the baby down. You can cuddle the baby or probably sing for the baby or talk to the baby just to calm the baby down before putting the baby at breast so that the baby can properly latch to the breast and also enjoy your breast milk. Any mother that starts breastfeeding at the first week or first phase of the breastfeeding, most mothers experience soreness around the nipple, but there are certain practices that can also cause the mother to have soreness around the nipple. The first thing we're going to talk about is wearing of tight bras or clothes. Now, we advise that you need to wear probably kind of loose cotton clothes that will enhance aeration around the nipple and also prevent using soap or shower gels around your breast. What happens, these gels and these soaps takes away the natural oils that lubricates your nipple and prevents probably dryness and also breakages or sore nipples. And also one thing you need to know is this: you need to also prevent sudden breaking of feeding or breaking suction. Some mothers tend to pull their breast away from their babies if they want to stop breastfeeding or want to break for any home chores. That is a bad habit. What happens is this: during breastfeeding, when the baby properly latches to the breast, the nipple is attached to the hard palate of the baby's mouth, which is then licked by the baby's tongue to stimulate the ejection of milk. When you pull it out, just like that, it wraps the hard palate. But at the first instance, it may not cause any breakages or probably damages around the nipple, but the continuous doing of such actions can lead to sore nipples. And also one thing that I want mothers to also note around these issues about the sore nipples is this: if your baby do not latch well or probably attach itself properly to the breast during breastfeeding, it's one of the causes of sore nipples. So one thing you need to notice is this: if the baby does not latch well, they tend to find a way to get the nipple into their mouth. And sometimes in such actions, so that the baby, the nipple moves in and out of the baby's mouth. And that's what causes sore nipples. Sore nipples within 24 hours or 48 hours is supposed to improve. But if it doesn't improve, just talk to a medical doctor about it. And there's one home remedy you need to do. Right after breastfeeding, just allow air drying of your breast and your nipples. Or sometimes you can express a little amount of your breast milk with a clean finger, just rub it around your nipple. And with the antibiotic effect of the breast milk will also help improve the healing of sore nipples. During breastfeeding, some mothers who experience low milk supply tend to be discouraged and will not shun away from breastfeeding. But one thing you need to know, there are certain instances that may cause, or there are certain events that may cause low milk supply. The first thing to know is stress. So we always advise breastfeeding mothers to shy away from stress. Now, you need to find a way to resolve stress. Now, stress has a psychological effect to the brain. Now, the breast milk supply is also connected to the brain. So if you are stressed, it also affects the breast milk supply. Secondly, the breast milk also is being produced from the mother's food that they eat, or the mother's nutrient stores. So we advise mothers to eat well. You need to eat well, eat a well-balanced diet. You need to drink water often so they can get a lot of water to be used in preparation of the breast milk. So aside the three that I've mentioned, mothers also need to breastfeed their babies frequently. Now, the more you breastfeed, the more breast milk is being produced for you. So you need to breastfeed frequently. And lastly, too, if your baby do not attach itself to the breast properly, or we don't have proper latching to the breast, it also affects breast milk supply. This is why you need to learn more about the various breastfeeding positions that may be very good for you, either as a cesarean mother of a twin, or a preterm, or a small size baby. So the paternal support, or the support by fathers in breastfeeding, is very essential. As I mentioned earlier, stress can even affect breast milk supply. So what we say is that fathers can support their wives or the mothers in a various way. One, the father can assist with some home chores just to release stress on the mother. There are certain times when babies start crying at home. Father can also help support by taking the baby and calling the baby to stop crying. This can also help reduce stress on the mother. And what we also advise is that some fathers can provide some form of emotional support through encouragement or nice words of affirmation, and sometimes some physical help through physical massage. And all these things can help in providing adequate support to mothers during breastfeeding. The Ghanaian's Women Guide for Feeding Babies and Toddlers, and this is a book I recommend to you. You can order a copy of this book from the Dromo Babies office in Accra.